I wanted to begin by asking you, Lauren, if you can please tell us what brought you to the office.
Well, originally I came here because I was having some trouble with my jaw. I couldn't open it all the way. I could only open it about halfway, and it was very painful to do so. I even had some trouble eating. I'd have to cut my food into very small pieces because I couldn't open my mouth all the way to eat. Like, I couldn't eat a sandwich.
She would have a lot of trouble opening her mouth, and when she did, it would pop. You could actually hear her when we would eat at the dinner table. You could actually hear the popping sound every time she opened her mouth, and it sounded painful.
Oh my goodness.
Yeah.
So then what happened, ladies? Well, you came here to Dr. Toomey's office, and what took place next?
Well, my treatment consisted, I was fit for a bite guard, and I would come back every few weeks to have it adjusted to realign my jaw, I think. And it ended up working out very well.
Oh, that's wonderful. So the bite guard is what the treatment option was
Yes.
in your case.
Yes.
And you basically had that put in, and then how often, like you were mentioning, a few weeks, every couple of weeks?
Every few weeks. And then as the treatment progressed, I would go for longer stretches of time without coming back to the office to have it adjusted.
Wonderful. And Elaine, what have you noticed since then?
Well, I remember when the first appointment, they measured her opening, and it was her mouth, how wide she could open her mouth, and it was 27 millimeters, which is really small. And they did the bite guard, and we came back, I think, in 2 weeks.
In 2 weeks.
And it was double that, just from wearing, I couldn't believe it, just from wearing the guard for those couple weeks.
My
That big a
goodness.
difference, and the pain started to subside, and the popping started to, it ended.
Decrease.
It almost stopped. Yeah.
So you've got your function back, your bite is, the
It's
radius is
wonderful.
back to what it should have been in the first
Mhm.
place, and now everything is back to normal.
Everything's wonderful. I feel great. I can open my mouth all the way now. I can eat that sandwich, and I feel so much better.
That's wonderful. I'm so happy to hear that, Lauren. Now, for the folks out there watching, Lauren, Elaine, maybe we can begin with you, Lauren. If you can, what would you tell them about Dr. Toomey and his practice?
I love coming here. It's so nice. Everyone's so nice, and it's really great. And I realized by coming here that there really is help. Before, I thought this might be something that I'd have to live with for the rest of my life. I didn't know. I didn't know if there were any treatment options available. But now I know there is help.
That's wonderful. And you're,
And
Elaine?
yeah, and the bite guard, she wondered about wearing that and thinking that it might be uncomfortable, or even Dr. Toomey said, you wouldn't have to wear it to school, but you did wear it to school.
I did.
And it's really not big. You don't really even notice it when you're wearing it, and it was easy. And she even says it's even comforting sometimes to wear it. So she wore it all the time. She wore it 24/7, except when you ate, right?
Right.
Yeah.
That's great.
So
Yeah.
it was easy treatment with big results.
Yes, indeed. And on that note, I'd like to thank you, Lauren, and you as well, Elaine,
Thank
for
you.
joining us and sharing your experiences with us here.
Thank you.
You're welcome.